for me, I've taken the torch of saying, you know what, I'm going to do some TED Talks on the same thing, because if we don't know what we don't know, how do we know what to fix, right? And if we don't know these tools exist, then how do we implement them? And so my goal has always been sharing.
So even when people have natural ability or talent, you need to have the work to back it up.
Yeah.
But in terms of how I keep up, I agree. I mean, the pace has just been astronomical. I think in tech, the pace is always fast, but over the last 5 years, I have observed that the pace of innovation, the types of innovation, the stakeholders involved, that is all really accelerated.
Talk about a little bit about career advice. So a
Mhm.
lot of people look up to you. You're a well accomplished person, professional, and they want to be like you. They want to be in your role. What is maybe one or two words of advice that you would give someone who aspires to be, in a role such as yours?
Today, I'm very excited. My friend Saira Haque is here. She works for Pfizer, leads health informatics, and very interested in policy and governance. And we're going to talk to her about AI and how larger companies, especially pharma companies, are utilizing and integrating in their workflow. Again, thank you so much, Sarah, for joining. If you can introduce yourself to the audience so that I'm not mucking up some things.
Well, thank you for having me. It's a pleasure to be here. As you said, my name is Saira Haque, and I am a health informaticist by training. So I'll start with my journey a little bit. After undergrad, I went to Michigan. I did my master's in Health Services Administration at the School of Public Health in the Department of Health Management and Policy. And so, really, from the beginning of my career, I've had a focus on policy and its application in real world. After that, I worked in management consulting for a few years when I went around the country implementing different types of implementations for information systems. And that was before we had a whole host of big EHRs. So we did things like design and develop custom billing systems, which doesn't really happen now, or implementing Meditech wide scale or things like that, which was
So you
really
are the
great.
reason that I hate medical environment now. Just
Well,
kidding.
what's funny is I feel like at the end, there's so many compromises that are made that everyone is mildly dissatisfied. So that probably is true for a lot of things in life, not just health information systems. But there's a whole host of considerations, and I think you don't truly appreciate it until you're leading something like that, because there's considerations across all the stakeholders. There's certainly regulatory, payment, all the kinds of things that all have to be considered. And I have really enjoyed building the compliance office. It was really fun to start something new and develop the systems and processes. But that's not where my heart is. I actually didn't enjoy being the compliance officer as much as building the office. I went to RTI, which is a research institute, after that. And I started as a health IT research scientist. And when I left 11 years later, I led the data interoperability and clinical informatics program. I then moved to Pfizer, and I've been there almost 5 years as a clinical informaticist. And now I lead the advanced medical solutions team, which involves both clinical informatics and practical research. And so throughout all of these experiences, they are different in a lot of ways, working in a hospital, as an administrator, management consulting, different types of research, and now. However, at the thread and at the core is using technology to improve outcomes. So, regardless of the setting, regardless of the different way, that's been the common thread throughout my career. And so I wanted to talk through my journey because a lot of people listening might be
Yeah.
coming from different types of backgrounds and not really see how their own educational background or employment experiences can lead
Yeah.
to different types of careers. So I thought it was important to share that for people who might be listening.
No, love it. I mean, it's interesting. So, what is your current role at Pfizer, and how are you sort of looking at healthcare AI in general?
Mhm. So I work in U.S. Medical Affairs. So that means that's the department that I work in general. And I lead
Mhm.
a group called Advanced Medical Solutions, which is comprised of clinical informatics and applied research. In terms of the applied research, we're really looking at solving real world problems in identification of patients, management according to guidelines, and quality improvement initiatives. I also have a group of clinical informaticists who are trained, and we work across the spectrum, really, looking at things like EHRs to help identify patients for clinical trials, EHR innovation once people are in the system, real world data and evidence and different analytical techniques, and then evaluation and continuous improvement. So there's really a whole host of team things that the team does. Now, one thing that I would like to kind of point out is that AI is I guess the latest in a series of technical innovations. Throughout my career, I have observed, I guess, like a little hype cycle of different aspects. And so, with all of these things, the technologies are different, but the underpinnings are the same. The underpinnings of what needs to happen to make something successful beyond the pilot is pretty much the same. And that's actually something that I really enjoy is taking something that we're studying as perhaps a pilot study or an initial feasibility study, research, that kind of thing. And then how do we take it long broader? How do we scale? And I like the innovation, obviously, as you can tell from my career. And I also really enjoy thinking about what do we do to take those things and bring innovation to more people. And so it might not be that everyone gets bleeding edge right away, but by taking things broader, even one step at a time, we can move towards better patient outcomes, which is really at the end of the day why we're all doing this.
Love it. Love it.
Go ahead, Harvey. Floor is yours.
No, so many things I want to say. For me, I've taken the torch of saying, you know what, I'm going to do some TED Talks on the same thing, because if we don't know what we don't know, how do we know what to fix, right? And if we don't know these tools exist, then how do we implement them? And so my
Mhm.
goal has always been sharing.
Yeah, this is a super fascinating discussion. I've written down several questions for you that I think
Mhm.
might resonate with the audience. And you sort of touched on the edges of some of these, but how, this is your profession, and
Mhm.
so you have a little bit extra pressure on you. How do you keep up? So I'm just curious if you have any personal like hacks or things that you do, or does it just come natural because you're in it?
Oh, I don't know if anything comes naturally to anyone in terms of all this kind of thing. So even when people have natural ability or talent, you need to have the work to back it up.
Yeah.
But in terms of how I keep up, I agree. I mean, the pace has just been astronomical. I think in tech, the pace is always fast, but over the last 5 years, I have observed that the pace of innovation, the types of innovation, the stakeholders involved, that is all really accelerated. And I will say that I use them a lot to keep up because there's a whole host of things like conferences. I'm on the industry council. We get newsletters every day. So there's things like that to help keep up with the forefront of what's happening with search. I've also been pretty involved in policy. And so I subscribe to a number of governmental type newsletters to keep track of what's happening on the regulatory side, which is a little bit different because the pace of technical innovation outpaces the pace of regulations, policies, organizational governance, et cetera, which is to be expected. One reason that AI is even possible is because of technological advancements. So it's possible to analyze more data. It's possible to integrate across more data sources. And so it's important to keep track on all different types of fronts. And yes, it's a lot, but if we don't keep up, then you'll get left behind. And so I really encourage people to keep up with what's happening, but also in different arenas.
Talk about a little bit about career advice. So
Mhm.
people look up to you. You're a well accomplished person, professional, and they want to be like you. They want to be in your role. What is maybe one or two words of advice that you would give someone who aspires to be, in a role such as yours?
Yeah, it's a good question because I think that career development and even the way the career landscape now is very different than it was when I first started my career. And I think that's important to note. The environment is different, the context is different. One thing I'll say that I'll start with is to be open to all different types of opportunities. When I first did my master's, I wasn't really thinking about technology that much. I liked technology. I thought it was interesting. I did some things with it, but it really wasn't on my radar. But as I came in and did my coursework, and then as I did management consulting, where I started the strategy practice, actually, I really enjoyed it because I came to see that technology, systems, processes, and strategy are really all linked together. And I actually came to enjoy aspects that I didn't even know existed. So one thing I'll say is to really be open to different experiences. And not to, another thing I would say is I've observed a lot of people who ask me questions will often cut themselves off before they apply for something or before they put themselves into consideration. And I always think, you don't have to cut yourself out. Let them do it if they're going to cut you out, or put your head in the ring and think, because everyone has a whole host of different experiences. And I say this all the time: if you do what you always did, then you're going to get what you always got, and then you're not. And the world isn't the same, so we need to move. And then the
Yeah.
last thing I'll say is, if you're going to do something, commit. I say this all the time too: if you're going to ring the bell, ring it. Don't just like half-heartedly ring it. Don't, don't, kind of go half in. That's right. That's right. If you're gonna go in and go in full force. Put your best effort in and don't go in half-heartedly, because that will influence what comes out. It might not be that everything is successful. The very tenets of innovation mean that they won't all be successful.
Yeah.
That otherwise you're not being that innovative. If it all is, if it's 100% successful, if everything goes 100% according to plan, you haven't pushed the envelope enough.
Yeah.
So we need to be comfortable with that, and then also to think about, what can we learn from things that didn't go as planned.
Yeah. Thank you so much. This is like a commencement speech. It's so good.
It was.
I mean, that is a great compliment.
Yeah, I gotta jump in. In the age of AI, and I'm gonna bring this to AI, we're all scared that we're losing our jobs, and oh my gosh, AI is gonna replace me. But listen carefully to what she said. She put herself out there, and she hired people, and she wanted to be the people that wasn't common. Because if you think about it, to her point, if we're trying to do the same thing and we hire the same people that think like us, we're going to get the same answers that we were going to give out. But if we get someone different, i.e., your personality, your clinical gestalt, what makes you, your personality, that secret sauce of you, plus now we'll throw in the modern AI and you put it together, you're going to get some crazy good output.
But one piece of that is also being comfortable with having discussions where we don't all agree on what the core problem is. But that's because of our experiences and background. And it's important to shape that and really embrace it so that you have a better solution and that you have better answers to the things that you're trying to address.
From 1 to 10, 10 being definitely in the next 3 years, and 1 being, how would you rate that this is actually going to happen? Because I'm just going to be honest, is there really a drug out there by AI? I mean, I know one of them, but what I'm saying is that, what do you feel in the industry between from 1 to 10? Do you think this is or
I don't think that things are so black and white in that sense, because there's aspects that are happening right now. And, will there be 100% AI developed drug without people involved? That doesn't seem likely. Will AI be used to influence various aspects? Yeah, that's happening as we speak, somewhere probably right now. And so I think what we could really think about, and one thing that I really am excited about, is how can we use AI to really make things more relevant for particular populations and subpopulations. And now, from at the health system level, more people are capturing data around different types of subpopulations. So when you marry that together, we lead to what Harvey was talking about earlier, which is moving us more towards precision medicine.
In your opinion, we are getting closer from what we used to say, like, okay, statin for everyone, to a specific statin for this particular population. And then eventually you're going to say that Junaid needs to this particular statin period, and we are probably going to customize it for him. But what do you think that from a global regulatory alignment on AI, where are we at? And what do you think, how would you govern, let's say, a biosimilar or for me, or a statin for me? And how do you actually deploy it?
It's a great question. So a couple things. One thing I was thinking about as you asked your question is, so yes, there could be a specific statin design that is for you, for instance, but perhaps you have a different LDL target than Harvey or Ed or me. Perhaps the target that we're even aiming for is different based on our particular health and our particular background, our particular demographics. So even before we get to the medication, we have to think about, well, what are the goals for us and why? And so then right now we're relying on providers to keep up with their knowledge of what's happening in the literature, to understand, perhaps to look at, well, what is this patient cohort for this particular person? So like everything, there's positives and negatives. I'm not casting aspersions. The intent was great. The intent was good, but then, there's things that happen. And so, and going back to that funded study, a lot of people don't know about it for a variety of reasons, because it's more in the research realm. And that's one reason I'm so passionate about taking things from pilot to practice, because what's the point of having that cohort? And that's just one example, but in general, what's the point of doing all that if we're not going to scale it?
The other one I added was courageous leadership, because I know so many times, people are just afraid to make a decision, and I had to be I've got some scars. You get scars from it too, but that's what leadership is. If you don't have scars, you probably weren't a very good or aren't a very good leader. We got to be the one, go out there and make things happen within your organization.
I did want to highlight one thing before, though, about the bias and representation of data. That's something that we really need to spend a little bit more time on as an industry and as thought leaders, researchers, as people in this space. So many models, even models that are implemented and widely used in clinical practice, are developed on local data sets. And what I mean by that is they're developed on a data set at one institution in one region. And the amount of times that those models are validated on a national data set, on a more representative data set, and then adjusted before going into practice, it's not as high as you think. Then we have to think about the data, and we have to think about the provenance of the data. We have to think about who's in and who's out of data sets and why. And then going back to the policy that I cared about in the beginning, well, why aren't people in data sets? And there's a whole host of reasons that it's good to use them. But every single data set, there's no data set in the world that's a perfect data set. There's no such thing as a fully representative data set. That doesn't exist.
Harvey, what are your thoughts on synthetic data? That's the right term, which people use. I don't like the word. I use the word augmented data. And the reason I use the word augmented data is because it comes from actually the basis. Harvey, first you go ahead with your digital twin and everything, and then I'm going to ask Saira that do you think it's ever going to be implemented in industry?
This is a big controversial area. I'm biased when I say it. I think synthetic data, doing it correctly and being a data scientist from that perspective, I see a lot of weight to that. And I think it's a good thing because, again, my focus is the patient. How can I help this patient? And if I can get over the culture and create a new paradigm way of doing things and helping my patient, then I personally feel ethically it's a crime that I'm not using this technology if I see someone dying because I'm not using it per se.
Yeah, I think that there's a lot of promise. And I don't think it's really a matter of if it's going to be used, but the degree to which these data sources will be used and the degree to which people will use the digital twins they're there now, right? Like they're there. There's I do like your idea of augmented data versus synthetic data. I like that term.
If you had a magic wand and a wish list to actually use personalized medicine in 1 year, what would that actionable item be?
One is going back to our data conversation before. We have data on a whole host of conditions. We have data on different types of people, but it's all over the place. It's not all structured, and it's not representative, as we talked about before. So I mean, I know, it's a magic wand. So with magic, I would love to see an actual representative data set that's integrated across systems, settings, etc. And I think that that would be amazing because by fixing that problem, you fix a lot of what happens later with AI. And if we could include things that are health related, but not health data, for example, workouts, wellness, things like that. So those are things that very much relate to health, but aren't actually available in many EHRs, for example, or people may or may not ask about them. Or, like patient generated data. We haven't even touched on wearables and all those kinds of things. So when I'm talking comprehensive, I mean comprehensive. That's what I would like to see.